Hi, thanks for coming to our second Leadership Tabletop Conversation, brought to you by the Texas Injury Prevention Leadership Collaborative. This week, Kristen Beckworth from Texas Children's Hospital, Jennifer Northway from University Health System, and Marissa Rodriguez from the Texas Injury Prevention Leadership Collaborative give their thoughts on how the COVID-19 pandemic has changed how injury prevention professionals engage the community during these challenging times. Let's see what they're saying.
Now that we are forced to be home and not able to sort of engage with the community in the same way that we've always engaged with the community, it's been really, I think it's just forced us as injury prevention professionals to sort of think outside the box. Like, we know we need to still reach out to some of our community members, stakeholders, but now, like, I'm trying to think, just this past week, I was thinking, okay, clearly people still want the information. How am I going to get that to them different? Because usually we're like, oh, you want a presentation? Yeah, let me come up to you and I can set it up. I can set up the presentation and come to you, because that's kind of how community work works. But now I'm like, okay, I need to do Zoom, but do families know how to use Zoom? Can I use WebEx? And so I'm now forcing, I'm really struggling, like, okay, what do people have? What can they do? And so we're asking questions that previously we weren't asking. So I don't know what you guys are doing, but it's sort of, I'm struggling with that a little bit.
Yeah, definitely, Marissa and Jennifer, it's good to see you guys kind of virtually. I agree. It's hard because of what we are taught and kind of ingrained as public health professionals and as folks who work closely with our communities. It's hard not to be able to touch and feel and get out there kind of in the field and share information and resources that we know, we know that our information is still valid and very much needed. As you see, rates are kind of climbing for some of these home injuries. And it's hard not being able to jump in and just jump out and put together a presentation or schedule an event or, whatever programming we're accustomed to doing in person. It's just kind of trying to navigate these new waters and figure out how to do it virtually. One of the things I've said in talking with folks is just there's pros and cons to this pandemic. And I think pros in terms of what we're experiencing as injury prevention professionals is just learning all these different tools that we can add to our toolbox that hopefully we can continue to use whenever we resume whatever the new normal will be. And so I think you mentioned all of those virtual, Zooms and WebEx and things that I had never heard of, but am learning. And so I think that's going to be a pro for us, is to be able to have some of those tools and share them with families to continue to share messaging. So.
Mm-hmm. No, I would agree. I think we've really found some benefits. It's a challenge to figure out the virtual piece, but there have been some areas where it's worked really well for us. I know, Kristen, you'd said this worked well for you too, but we've been doing virtual car seat education with our families, and surprisingly, it's worked better than I had expected. I was really hesitant in the beginning to, we were very nervous about how well that was going to work and if families could replicate a proper install, but it's gone really well. Families have still been very appreciative of those efforts and have really liked the education. I have found myself stumped, though, with some other audiences. The technology option has worked well for our patients who are parents of newborns or who are expecting, but we also have a large older adult fall prevention program, and we still have a lot of living communities that want to get this information to their older adults, especially since they're at home more and maybe they're not moving as much. We've heard a lot of folks say that older adults are fearful to get out, even though there's not been any discouragement to exercise. And so a lot of our partners have asked for information on how they can continue to get their seniors moving and engaged. And we've really struggled with the virtual option for that population. And so we've had to explore, are there videos that we can tape, or there are existing resources that we can send to those locations to share? We haven't actually implemented it yet, but we're exploring a partnership with our city television, because we have a city television channel, where it wouldn't require somebody to have cable or have internet, where maybe we could tape some things and share it through that venue. So we haven't accomplished that piece yet, but we're trying to figure out something.
Yeah. Jen, are you finding that are you doing virtual inspection stations? I know others that are doing that, and so I'm just, I know that's a new skill set too, because you're doing it not in person. So it's a new
Right.
skill set now that people, maybe some have, some don't, but they're having to learn how to educate and talk to folks when you're not, don't have them in front of you.
We really learned from Kristen and her team because she kind of helped us in the beginning figure out some technology options for that. But you're right. I mean, I think if anything, as a certified car seat technician, it's going to cause you to really become a better coach, which perhaps is really the best thing for us to do anyway, right? The whole point of being a car seat technician is for us to be able to explain to people how to accomplish the task, not do it for them. So I'm hopeful that this challenge is going to help us improve our educational skills. I will say, I don't know how Kristen's gotten over this, but we discovered really quickly it's very difficult to show somebody how to install their car seat if you're holding the phone and trying to do the install with one. So you have to figure out some of the equipment challenges for sure.
And definitely, like, to piggyback on what Jen just said, I mean, one of the challenges has been learning how to explain how to do something. As technicians, you know, we are hands-on people. And so when I'm in my home and that parent is way across town and we're over an app or FaceTiming and I'm talking them through something, I can normally touch it and grab it and move their hand or put their hand somewhere. And so really learning how to give these verbal commands, and it's strengthening, I think, as technicians, it will strengthen our capacity to educate, because now we're not able to be there in person. And after this is all over, you know, we've talked about that as technicians, our practice may really change. You know, we may not be able to go into a family's vehicle. We may not even be able to be, you know, up close and in person with them. So, you know, these tools that we're learning to strengthen our ability to educate from afar, I think, are only going to serve us well. But it's frustrating to not be in person and be able to touch and feel.
Absolutely. And I think it's important too, because those new technicians are reaching out to some of us and I'm like, okay, what are you doing? And how, you know, they look to us for guidance. So we're trying to figure it out quick to be able to mentor and help them. So yeah.
I had another. Sorry.
Go ahead.
So we talked about car seat safety, but, you know, car seat safety, for the most part, we're seeing different trends in Houston in terms of like our crashes and our fatalities. It's weird. It's like some of the crashes have been reduced, but the severity is increasing. So I don't know if people are just happy to finally be out of their houses and driving crazy, or what the issues are. But in terms of injury rates, one of the challenges for us in the Houston area has been an increase in our submersion rates. We knew that was probably going to happen as more people were staying home, and, you know, parents are distracted trying to remote work and balance everything that's happening in the home. And of course, it's getting hot in Texas, so people are looking for ways to cool off and keep their kids busy. The frustrating part for me, and I don't know if you guys share this, but watching some of these injuries increase as injury prevention professionals, knowing that we have this evidence-based programming and work that would help prevent these injuries from happening, and not being able to give it out in the manner that we're accustomed to. How are you guys handling that?
Oof. That's a tough one, Marissa. Because I think, to your point, like there's just some, like I mentioned with the older adults, we're just trying to be creative. We haven't seen the submersion issue, but we've really seen a huge increase in MV PEDs because more families are out and about, enjoying outside and trying not to be so cooped up. But to your point, our traditional avenues are closed to us. And so we've just had to be very creative with using our social media. We've got a partnership with a company here called Safe to Save that is a distracted driving app. We've started to place some messaging within that app, not necessarily related to distracted driving, but even using that as a channel to get other information out to a younger stakeholder group. I think it's a daily challenge for sure. Marissa would have.
Some of your partnerships, I think, you know, that's one thing that we all have to kind of remember, is that we do have partners who also have had to change their practice. And so tapping into some of those relationships that you have that maybe you've not utilized for prevention strategies, or not in the way that you want. So like one of the examples you mentioned, we're going to work with our Houston Apartment Association to get out water safety information to them, because we know that there's tons of families that are living in these apartment communities and they have a way to access them that we don't. Normally we could go to the apartment and put on all sorts of water safety programming in their pool. That's not going to happen anymore. So definitely trying to figure out what partners are in place that maybe can help us continue to share messaging.
Yeah, like recently I spoke with some police officer stakeholders, and they mentioned we're seeing a lot of just speeding. The roads are clear, so people are speeding a lot, and that's increased. And they talked a lot about, domestic violence calls that they're getting a lot more of. And so alcohol related, stops and things like that. So yeah, I mean, it's important to sort of connect with those stakeholders that can sort of help us move things in the right direction.
It's probably important to connect with them too, just so we don't lose those relationships, because we don't know when we're going to return to whatever normal is. And so you'd hate to lose, partners that you've partnered with because you've no longer been in contact with them and they've kind of moved on to something else. So I think it's important to keep prevention at everyone's kind of the forefront of their mind, even if we're not implementing programming the same. Just don't let them forget us.